The toughest healthcare policy challenge facing our state government is the General Assembly's refusal to expand Medicaid in the Commonwealth. States with both Republican and Democratic leaderships have helped close the coverage gap by expanding Medicaid, but Republicans in the General Assembly have blocked attempts by Governor McAuliffe to do the same. We're leaving billions of dollars on the table, money that could go to providing coverage to thousands of Virginia families. Expanding Medicaid would also help the Commonwealth combat the heroin and opioid crisis, which is the single biggest health crisis facing Virginia today. Expanding Medicaid would allow more Virginians to access the treatment and recovery services they need to fight their addiction. As Attorney General, I have fought to protect affordable, accessible health care for all Virginians, including those with pre-existing conditions, and I promise to never stop fighting. I am very concerned that as the Trump administration continues to try to dismantle Obamacare, it will use cost-sharing reduction payments that help millions of Americans afford health care as some sort of leverage or bargaining chip. That's why I joined with my fellow state attorneys general in a suit to defend these CSRs and protect them from any political games. 242,000 Virginians currently have a plan that rely on CSRs, and I'll keep standing up to protect their access to affordable health care. Combating the heroin and opioid crisis has been one of my top priorities while in office, and I intend to continue my efforts to tackle this problem in my second term with a multifaceted approach that includes enforcement, education, prevention, and legislation designed to save lives. I've implemented new law enforcement initiatives, strengthened partnerships with the medical community, and supported new recovery and treatment efforts to further expand our response to this crisis. My team and I have worked more than 90 cases against dealers and traffickers involving more than 434 pounds of heroin and fentanyl, but I know there's more work to be done. That's why I've called for new laws to crack down on deadly fentanyl, incentivizing alternatives to opioid prescriptions, and eliminating federal restrictions on using Medicaid in residential treatment settings. I'm also working with a bipartisan group of state attorneys general to hold distributors and manufacturers accountable for their role in this crisis. My team and I have been working on this problem every day for nearly 4 years, and we're not going to stop because we're still losing too many treasured friends, spouses, siblings, children, and parents to this epidemic.